The topic this morning is infant health and immunization, and we're talking to Dr. BNabitt-Stephens from Harry Medical College and Miss Peggy Halperin from the Metropolitan Health Department. And Ms. Halperin, before we had our break, we were talking about immunization. I think I indicated that April is the month of immunization on a national scale. And let's have you to give us some information about what the Health Department is doing and what it has done in reference to this dealing with immunization.
I'd be happy to. My main involvement with the immunization program at the Health Department has been through their birth certificate registry, immunization registry and tracking system, recall and reminder system, which sounds like a lot. It's efforts that were begun several years ago with funding through the Robert Wood Johnson Foundation to plan and then implement a method for tracking children who are born and reside in Davidson County as far as their immunization status is concerned. It's very important, and Dr. Stephens can certainly speak to this, extremely important that children be adequately immunized, age appropriately immunized against diseases that can be lethal, but which are completely preventable if they have these vaccines at the appropriate intervals. What the Health Department has been involved in through funding, through local funding, and also through grant funding through Robert Wood Johnson, has been in planning and implementing this registry. What occurs is when a child is born and resides in Davidson County, information about that child is entered into the registry. Following that, the family of that child is sent a reminder card at appropriate intervals, at 1 month, at 3 months, at 5 months, and so on, all through the first 24 months of life.
That's every child in
every child in Davidson County, to remind the parent that an immunization or 2 or 3, whatever is due at that particular point in time, is in fact due, and that they should contact their medical provider, whoever that might be, and make an appointment and bring the child in so that the child can then receive this immunization. Folks in the community might have wondered what these cards are when they come in and say, what is this? This is from the Health Department. Well, indeed, it is from the Health Department. It doesn't mean that the child needs to be brought to the Health Department. In times past, the Health Department was much more involved than they currently are in actually giving immunizations. Since the advent of TennCare, folks who have TennCare can now go to their TennCare provider and receive those immunizations. The Health Department does still give some immunizations in their clinics, but not nearly as much as they used to. If we do not get a response from this mailing, then that child will be followed up on either with a telephone call or by a visit from an outreach worker who will try to contact that parent and say, you know, your child is due an immunization. Have they in fact received that immunization? Because they might have, and we just didn't get that information back. The goal is to increase the number of children who are age appropriately fully immunized through 24 months of age. What happens is, or has been happening, is when a child goes to school, they must be fully immunized. It's the law. But there is nothing that says that they must be fully immunized at this early age, which leaves them completely at risk for diseases that are totally preventable until they reach school age. And one of the things that started this initiative on the part of CDC in Atlanta and a part of the Robert Wood Johnson Foundation was a measles outbreak that occurred in, when was it, 87? 87 in New York? Or that was a bad pocket.
And Texas.
And in Texas.